My name is Bia Carlini. I'm a senior research scientist here at University of Washington, and also I staff from Northwest ATTC. One of my roles is to coordinate the webinar series. We are going to get questions at the end, and you can do by the chat box, and thanks so much for everybody telling me the sound is good, and we'll go from there. So it's my pleasure to present you today to Dr. Neha Chawla. She is the founder and director of Seattle Mindfulness Center, and she co-created with other authors the Mindfulness-Based Relapse Prevention intervention. She's also co-author of the Mindfulness-Based Relapse Prevention for Addictive Behavior, and a group facilitator and trainer. More important than everything, at least on my side, she's a dear friend, and I respect her work very, very much. So without further ado, we'll now transition the slides to Dr. Chawla, to Neha. And Neha, remember you have to click on the slide first so you have control, and you can do and present. Thank you very much, and welcome to the webinar now.
Thank you so much, Bia. So this is kind of a new format for me. I'm used to seeing people's faces usually when I'm presenting, so this will be interesting. And I look forward to hearing from you and answering your questions towards the end. But just to give you a little bit of a roadmap for where I'm hoping to go today, to talk a little bit about why we thought to come up with this program, Mindfulness-Based Relapse Prevention, in the first place, to spend a little bit of time just talking about what mindfulness is and how it is applicable to treating addictive behavior, and then to really spend some time talking about the MBRP program, what it looks like, some of the practices and exercises, and some of the research evaluating the program as well. So starting with this question of, why come up with a mindfulness-based approach to preventing relapse in the first place. And just to tell you the story of how this came about, we really started developing this program in 2006. So it's been about 12 years. And at that point, there wasn't really a mindfulness-based approach to treating addiction. Since then, there's been various other things that have popped up as well. But what we know about addictive behavior is that relapse is kind of the hallmark, and it's often even described as being a chronic relapsing condition. And that coping skills, relapse prevention, which I'll talk about in a moment, are helpful in reducing the frequency and the occurrence of a lapse or relapse. And so the question was, well, would mindfulness be a coping skill? Would it be a technique that helps people better apply the other skills that they do have? So that's kind of the question that we started with. Sorry, I'm trying to go to the next slide here. And as far as other existing treatments, we know that cognitive behavioral relapse prevention is a well-established treatment for not just substance use, but also other process addictions. And it doesn't always prevent a lapse from occurring better than anything else, but it does seem to be more effective at delaying and also reducing the intensity and the duration of a lapse. So our hope here was to say, why don't we take something that we know is effective and see if we can integrate that with mindfulness practices and skills, and see if that increases the efficacy of relapse prevention. And even just to ask the question of, okay, is it possible to truly integrate the two? Is this something that's feasible? Would people actually be interested and engaged with something like this? And even if it isn't better than what we currently have, are there certain people who would be more attracted to such an approach than to a more traditional approach? So shifting for a moment to mindfulness, talking about what it is, and many of you are probably aware of just how popular mindfulness has become in the last 10 years. And when we first started developing this program, it really wasn't. Here is a graph that shows you just the number of research studies on mindfulness by year. And as you can see, there's been a proliferation really in the last 10 years. But it's a lot more effective to practice mindfulness to get an experiential sense of it than to talk about it intellectually. And so I want to take just 5 minutes or so to do a little practice here. And I'm going to walk you through it. So wherever you are, if you're sitting in front of your computer screen, if you have notes or anything in front of you, I want to invite you to put everything aside if you're willing to join me. And just take a moment to settle in, find, posture that feels supportive for you. You can close your eyes if you'd like. And I just want to invite you to start by bringing some awareness to what's happening for you in this moment. And especially bringing some awareness to your body. So you might notice just the sensations of sitting, places of contact or pressure. You might notice what your mind is doing, if there are thoughts or feelings. And then I want to invite you just to take a moment to become aware of your breathing. So maybe noticing where in your body you feel your breath. Maybe you notice it in your chest or in your belly. And there's nothing you need to do here. You don't need to change your breath or deepen it or lengthen it, just noticing. And seeing if you might bring your attention just to one inhale and exhale. So maybe feeling that slight expansion on an inhale and contraction on an exhale. So just for a few moments, staying with the sensations of your breath. And you're likely going to notice pretty quickly that your mind wanders away. It drifts to thoughts about how you're doing in the exercise, or about the future or the past. And none of this is a problem, it's just what happens. So when you notice that, seeing if you might invite your attention back to the next breath. And again, noticing where the mind is, and gently inviting it back. And then when you're ready, if your eyes are closed, you might go ahead and open them. And just to talk through what you noticed in that practice. So, here we are, and I asked you to close your eyes and bring some attention to what was going on for you. And then to pick an object. So in this case, we picked the breath. And to bring your attention to the breath. And then you probably noticed that your attention wandered. So then I invited you to notice that wandering and simply to come back, to begin again. So to return to the breath. And this is a very simple illustration of what mindfulness is. So there's a few components here. One is attention, paying attention to the breath. Noticing the attention wandering and bringing it back to the present moment. So what's happening right now. And to do this with an attitude that is inviting, that's gentle, that isn't judging or harsh, kind of like a friendly attitude. So there's a lot of definitions, some understandings of what mindfulness is, some misconceptions, but here is a very simple definition. Awareness that emerges through paying attention on purpose in the present moment and non-judgmentally to the unfolding of experience moment by moment. So the important pieces here are the three components that we just noticed in our own experience: paying attention, coming back to the present moment, what's happening right now versus the past or the future, and doing so without judgment, with this attitude of friendliness, of curiosity. So that's a little bit about what mindfulness is in the simplest possible way. And now if we could reflect on why it might be useful for addictive behavior. What about it feels relevant for addictive behavior? So sticking with those three components that we just talked about, attention, present moment, and this non-judgmental attitude, and applying those to addictive behavior, we can imagine that paying greater attention, having greater awareness of things that are triggering for us, as well as reactions to those things, could be useful in interrupting our automatic reactions and behaviors that follow from that. We could also imagine that being in the present moment, or accepting or allowing what is arising in the present moment, might reduce the urge to then escape or avoid it by engaging in substance use. And that attitude of non-judgment can help sort of loosen some of the self-critical thoughts that often drive addictive behavior. So this is, if some of you are familiar with or have used motivational interviewing or the Transtheoretical model that it's based on, I think mindfulness as an approach fits really nicely with that as well. So it doesn't matter sort of what stage of change you're in. If you're at a contemplation phase of change, having greater awareness of the ambivalence that you're experiencing can sort of magnify that and move you forward in the process. That awareness can really help with preparing to take action and perhaps seeing where that action needs to be. I think the Mindfulness-Based Relapse Prevention program fits really well with the preparation and action stages, and also with the maintenance stage, where it's continued awareness to make choices that are in your best interests. And, if you do slip, to sort of minimize the shame and self-judgment, and to kind of come back to the present moment, get back on track. So shifting to talking about the specifics of the MBRP program, the program was, as I mentioned earlier, we started with the intention of integrating relapse prevention with mindfulness. And at first, we had the idea of just doing an intensive mindfulness program and wrote a grant to do that. And some of the feedback that we got was that, well, nobody's really going to engage with this. It's too demanding. It's too intensive. So the feasibility would be a problem. And so we looked to, what other people in other areas had done. And the most established approaches at the time were mindfulness-based stress reduction, which was developed for chronic pain initially, and mindfulness-based cognitive therapy for depressive relapse. And we thought, well, why not just model our treatment on the basis of these two approaches? Which is what we did. So the program is designed to be an 8-week program, although people have used modifications at this point, done it in different settings on a rolling basis. But the original program is an 8-week program where people meet for 2 hours a week in a group setting. And then between sessions, people are going home with some kind of home practice, worksheets, exercises, but also mindfulness meditation practices that they can engage with and then come back and talk about in group the following week. The components of the program include what we refer to as formal meditation practices, mindfulness meditation practices. So these are things where you're kind of taking time out of your day to listen to a guided meditation and to really make this an intentional part of your life. And then more informal practices, which are things that you can do in the course of your day-to-day life. So in the midst of stressful situations, as you're kind of walking from one place to another, And then also more cognitive behavioral strategies, coping strategies, worksheets, things like that. So the program includes all of these components. The core intentions of the MBRP program, so the first is really just to increase awareness. Increase awareness of our thoughts, of emotions, of bodily sensations, and of things that are triggering, so that we might interrupt behaviors and reactions that feel automatic and out of awareness. And then to shift from this kind of automatic reacting to just having a greater sense of choice. So pausing and perhaps having the space and the ability to respond rather than reacting blindly. Another core intention of the program is really to start to shift our relationships to feelings and experiences that are uncomfortable. So instead of trying to push them away or fight them or even fix them, it's really this kind of way of being with and softening around, so as to sort of reduce the power that these experiences might have. Related to that, it's cultivating a more compassionate attitude towards one's experience. And then finally, supporting just a lifestyle that is more aligned with how we want to be, how we want to show up for ourselves and in the world. So the approach, the MBRP approach, it tends to be very experiential. There's practices and exercises. There isn't a lot of didactic elements. It's much more, let's practice together and then talk about our experience. And the way we're going to talk about our experience is very much what's going on for you right now in the present moment, rather than, a lot of storytelling about what happened last week or even your history, or anything like that. It's really important for people facilitating the program to be grounded in their own practice of mindfulness meditation. And so you're really modeling, this approach of openness, of curiosity, of non-judgment, but also can really address from your own experience sort of what's coming up for people in the room. And that's coming from you seeing for yourself how your own mind operates. There's this emphasis on we're learning this together. We're all kind of bringing this attitude of beginner's mind to what we're discovering together. There's no expert in the room. I'm a facilitator, but I'm not anyone to sort of teach you anything about your own experience. My role is to be a guide, and you get to see for yourself what your experience of your mind and body is, and learn from that. So one of the processes that's really important in the program is something we refer to as inquiry, and it's the way, the style in which discussion and conversation in the groups happens. And the purpose of inquiry is very much to sort of bring people back to their present moment experience, to their direct experience, and to separate that from stories, judgments, and things like that. So just to give you an example, someone in the group might say, in response to doing a practice, you know, I can't do this. There's something wrong with me. Other people in the room, maybe they can do it, but not me. And so then you might ask the question, okay, that is a thought that you're having, but what did you actually notice in the moment? What happened? And the person might say something like, oh, you know, I had this uncomfortable feeling of sadness come up, or, you know, there was pain in my body and it felt like too much. And so what you're doing here is trying to bring it back to the raw experience and say, okay, there was a feeling there, or there were sensations there. And then you had this thought of, I can't do this, or, you know, this judgment of there's something wrong with me. And so by engaging in this process of inquiry, you know, it's an opportunity for people to see the workings of their own mind and to separate their thoughts and judgments from their present moment experience. And then in the inquiry process, we're also linking this to the relapse process and saying, do you see how this parallels what happens when you relapse, or when you might have the urge to relapse? You know, maybe the thought that you have is, I need a drink, but what's really going on in that moment? You know, maybe there's a feeling of sadness, maybe there's discomfort in the body. And then to also start to see, by hearing from other people in the group, that this whole experience is not personal or specific to an individual, but it's really how our minds work, so that there's some kind of validation in that for people, and depersonalizing of it. So here's what the 8 sessions look like. So each session has a particular theme. And the first few sessions are really sort of focused on increasing awareness of autopilot in day-to-day life, of how that relates to relapse, increasing awareness of triggers, and just starting to bring that awareness into day-to-day life. Then to shift to talking about high-risk situations and relapse for each person in the group. And then finally, the last couple sessions sort of widen the lens a little bit and focus on self-care and maintaining practice after the group. So as I mentioned earlier, you know, the practices are formal and informal practices. So formal practices are things that we do sitting down or lying down, or are guided meditations essentially. And these include a body scan practice, where you're sort of bringing attention to, you know, sensations in different parts of the body. Sitting meditation, which is what we just did. You know, we did a mini version of that, but it really sort of starts with awareness of breath, using that as a way to stabilize the attention, and then to extend awareness to thoughts, emotions, body sensations. There's a couple other practices as well, something that's called a mountain meditation, which is, you know, to more of like a guided imagery practice that's helpful in sort of overwhelming or turbulent times. And then something called loving kindness meditation, which is cultivating sort of a friendly attitude towards oneself and one's experience. The informal practices include, and I'll describe this a bit more, might be familiar to many of you, but an urge surfing practice. Also bringing awareness just to day-to-day activities that we might otherwise do very automatically. So things like brushing your teeth or washing the dishes or taking a walk. We also do a little bit of mindful movement sometimes in the program. And then another activity called the sober breathing space, which is something that people can apply when they're in the midst of a high risk or triggering situation. And I will walk through that as well. So here's urge surfing. And the idea here is we do this by asking people in the group to imagine something that might be somewhat triggering for them. And we usually will ask people to pick something relatively small to begin with, and to really pay attention to what happens in the moment, what thoughts, what feelings, if there's an urge that shows up. And to experientially practice staying with that urge instead of acting on it, instead of doing the thing that we would habitually do. Even when it feels intense. And here's kind of, what happens. So if you're looking at the urge over time, people often will have the experience that I need to do something to put an end to this. Because if I don't, it's just going to keep getting bigger and bigger, and will be intolerable. And the reality is, that and this is kind of backed by a lot of research, but when we pay attention and really stay with that urge, and mindfulness enhances our capacity to do this, that what happens is that it might peak, it might be very, very intense, but that at some point it starts to subside. And, it may not go all the way down as it looks in this graph, but it cannot increase exponentially. And the other idea here is that over time, as we practice this, those waves might start to become a little bit smaller, or at the very least, we sort of can trust more in our ability to tolerate the discomfort of that without having to act on it or fix it. So that was urge surfing. And here's another kind of central exercise in the program. And people report using this one probably more than anything else in the program. So it's called a sober breathing space. And it's something that people can do in the moment. It doesn't take a lot of time. You can do it, when you're feeling triggered, when you're feeling yourself just on autopilot. And it simply involves stopping where you are or pausing just for a few moments and noticing or observing what's happening internally. So sort of taking stock of your thoughts, your emotions, your sensations. And then just like we did like we do in some of the longer practices, to bring your attention, to collect your attention and bring it to your breath, even just for a breath or two. And then to allow the attention to expand again, to include all of your experience and also the situation that you might be in. And from that place, seeing if there might be room, a little bit more room, to make a choice, to respond rather than react. And this isn't about, necessarily changing anything, but it's giving yourself that opportunity to take a step back and have a sense of choice. So those are examples of some of the practices and exercises. We do also have some more kind of cognitive behavioral exercises, worksheets. Here's an example of one It's called Noticing Triggers, and it's just another way for people to have some awareness of things that are triggering in their lives. So, making note of the situation, and then also making note of what happened in the body. So specific sensations that you might have noticed, emotions, thoughts, and how you responded. And again, the intention here is less to fix things and more just to notice what typically happens for you. So this is actually a home practice assignment that people are given in the second session as a way to increase awareness of triggers. Here's another example of a more kind of cognitive behavioral exercise. It's called a relapse chain, but we invite, usually from the group, an example of a situation where someone might have had a relapse in the past or could imagine that happening, and really break it down. It's sort of like a chain analysis of the situation, but asking them, okay, what was the specific triggering event? How did this start? What was your initial reaction to it? And then this doesn't look as neat as this. It often, is just following the person's experience. So it can look a lot of different ways, but it generally seems that there's two pathways. And one of those pathways is, okay, if you're able to have awareness, if you're able to apply some of these tools and really notice what's going on for you, what possibilities does that offer? Is there room there then to respond with some awareness? And in contrast, what happens, when we kind of get caught up in autopilot? This is also often emphasizing the role of thoughts in the relapse process, and what happens when we kind of buy into our thoughts or what our minds are telling us, and that might lead to a reaction or a lapse, which then triggers, further thoughts, feelings, body sensations, what in the relapse prevention literature is referred to the abstinence violation effect. So, now we've broken our own rule that we've set for ourselves, and there's often thoughts of judgment or shame, which further kind of keeps us locked into this spiral of relapse. So that's really it for describing the program, and I wanted to share. I know we have about 20 minutes left, and I want to make sure we have time for your questions. So I'll try to speed through some of this, but just to share a little bit about the research. I might skip over some of the slides here, but initially we did a small pilot study, and this was in 2007 to 9 or so, with people at a place that no longer exists, but it was called Recovery Centers of Kane County and here in Seattle. People who completed intensive inpatient or outpatient treatment, and this was their follow-up. So people were assigned either to receive 8 weeks of the MBRP program or to stay in their regular treatment as usual, which was usually some kind of process group and 12-step participation. And then we kind of did some assessments with them afterwards for up to 4 months. And this is just to give you a picture of who the participants in the study were. And, you know, again, this was a pilot study, was really just to see if the program was feasible and if there was any initial support for it. And yes, we found that there was overall increase in awareness, reduction in craving, and lower rates of substance use at follow-up. We also found that the reduction in craving was what mediated or impacted the reduction in substance use. And an interesting relationship between depression and or negative affect, depressive symptoms, and craving just for the people who went through the MBRP program. So there was less craving in response to depressive symptoms for folks in the MBRP program, but not in treatment as usual. And I have a bunch of slides kind of getting into this, but I'm going to skip over those, but would be glad to answer questions about this. But essentially, I'll just go over this one. I think this is interesting because it really addresses the self-medication hypothesis, that, you know, what's happening here in the mindfulness group is that people's depressive symptoms aren't necessarily changing, but their way of being with those symptoms, their way of coping with or tolerating those symptoms is shifting, and they're actually having less craving in reaction to those symptoms, and thus less substance use. And that was not the case for people going through the more traditional treatment. So we followed up with a larger study, which was more people, and this time we compared MBRP to traditional relapse prevention and treatment as usual, and evaluated people over a year, and found, again, positive effects for both MBRP and RP versus treatment as usual, that there was a higher probability of abstinence, of not engaging in heavy drinking for both groups, fewer days of heavy drinking when people did drink, longer time to first use actually for RP versus MBRP. But it seemed that whereas the effects were equivalent at 6 months following treatment, when we evaluated people at the 1 year mark, the MBRP group seemed to be doing a little bit better. So the effects seemed to be more sustained. And they showed a higher probability at that point of not engaging in heavy drinking and fewer days of drug use. So what does this mean? That both MBRP and RP were effective compared to treatment as usual at reducing both the severity of relapse and delaying the time to first use, but that MBRP may have more enduring effects beyond the 6 month mark. And this is kind of a crucial mark usually as far as relapse goes, that there's something about the mindfulness practices and skills perhaps that might sustain impact in the long term. So I'm going to pause there so that I can take some time to answer your questions. And please feel free to type those in the chat box.
Thanks so much. That was very, very helpful, Neha. I really like it. So again, it might be that people are typing the questions in another place. It should be in the Zoom webinar chat. And I will run and select the questions now. Thanks so much. So let's start. Let me just go back one here. Before we start with the questions, please help us to document how important this webinar series is by responding to the surveys that you're going to receive, one now and one in 30 days. So that's an important thing for us to continue our work in a way that better serves your needs. So feedback is very important. Okay, now questions. So first question, how do you encourage reluctant people to engage in MBRP?
So that's a great question. And we have tried different things, but one of the things, and actually one of my colleagues did a dissertation on this, but was to meet with people prior to their participation in the group, just to have a brief 20-minute interview with people. And it's almost like a motivational interview, and really to, instead of telling them, you know, about the program or trying to convince them to participate, really sort of eliciting their own motivation for it and asking them, you know, like, what's worked for you in the past? You know, why might you want to do this? And almost like even sort of deterring gently a little bit by saying, you know, this is a big commitment, and yeah, we're not gonna, you know, kind of teach you anything. This is really about you sort of like seeing for yourself, you know, by engaging in these practices to bring attention to your own experience. And he found in his dissertation, my colleague, that asking these questions and having this kind of 20-minute session beforehand did seem to increase people's participation and retention in the program.
Okay, so just to clarify, there are many questions or a couple of questions about how to obtain a copy of this PowerPoint of the presentation. As we do in every webinar event, this is also later uploaded in our website, the Northwest ATTC website. We may have a delay of 24 or 48 hours in this particular situation given our staff transition, but it will be available. Okay, so what resources for this treatment is available for people in Medicaid that you know of?
Yeah, I don't know. So I'll tell you where, you know, I mean, the program is being facilitated in a lot of different places at this point. We've done workshops and trainings for several years now and all over the world. So there's people, you know, doing it in the context of agencies, in hospitals, in private practice. So I imagine this is really dependent on the setting, and I'm not sure I can answer that more specifically.
No, not a problem. Did you ask participants for report on any negative or unpleasant effects they may have from the mindfulness practice? If so, how did they report? What did they report, and how did you manage them?
Yeah, that's a good question. And I'm trying to recall if we had anything like that in our assessment protocol. I'm not sure that we did as part of the protocol. We did screen people for psychosis and active suicidality. And the other thing that was of concern was trauma. You know, if people who had trauma history or PTSD, how they would fare in the MBRP program. And we did look at that, and we did not find any significant differences. So it did not seem like people, you know, with who endorsed a trauma history or symptoms of PTSD had any negative effects or differential outcomes in the study. I don't know if that answers your question.
Yeah, thanks. We are kind of pressed on time, so I don't know more. We can go to the back and forth here. Another question is about a shorter amount of time for patients cannot commit to the weekly sessions, more directed options for patients. So any shorter version?
Yes, so there's people who've experimented with modified versions. We've done a 6-week version, which seems to work fairly well. Again, I don't have data on this, but you know, anecdotally, it seemed to work pretty well. It's really distilling sort of the exercises and practices into 6 weeks. People have done it, you know, at agencies where you have to have rolling groups. You can't have a closed 8-week group, or the sessions are only an hour long. And so then it's kind of pulling the core components and coming up with like a series of sessions that keep repeating so people still get the content. And again, there is somebody who's evaluating that, but you know, we don't have data on these things yet, but anecdotally, it seems to be feasible and beneficial to modify it and still sort of get what you need from the program.
Good. Thanks. So there's a more researchy question here. So in the larger trial, who delivered the usual relapse prevention and MBRP? Were the same staff? How supervised was the for fidelity?
Yeah, thank you. So the treatment as usual, you know, was in the context of an agency. So treatment as usual was delivered by the staff at the agency. We trained therapists to do MBRP and MBRP. They were not the same therapists. So we picked, you know, therapists from the community who were trained cognitive behavioral therapists, had already done relapse prevention, and trained them to do our specific protocol. And then did a pretty intensive training for the MBRP therapists. They were all people who had an established personal meditation practice. And we did develop a measure of fidelity and had a team to code a number of sessions for each therapist, and we had pairs of therapists, and we coded their sessions for adherence and competence.
Good. So I'm going to try to put together a couple of questions here that are around the same kind of inquiry. So it's about the substances involved in the trials in the study. So were IV drugs included? There are some substances that the intervention showed better effect than others, greater success rate. Anyway, all this kind of thing. Medication assisted treatment were included. So tell a little bit about these specific substances.
Yeah, so you know, this study was done starting in 2006, and I imagine that you know, if we were to do it now, it would look quite different. So at that time, and the agency where we did this, the primary substance of choice was alcohol, and the other was crack cocaine. And then there was other things, polysubstance, but much, much smaller percentages. I know that there are people trying to do it now. specifically for opiate users, and those trials are kind of still underway. But yeah, that's what it was for the research that I presented.
Okay, thanks. I wanted just to have one more question before more question. Just I'm putting the last slide talking about our next webinar on December 19th. Please attend and if you can. The last question, and I have to choose here, so you know I have the executive power to do that. So I'm going to do that. So just to close, the last question is how the intervention or MBRP that you just presented is different from DBT, dialectical behavior,
Yeah,
and which one is more effective?
that's a great question. You know, I mean, I think DBT, from my understanding of it, you know, that it's got mindfulness, a mindfulness-based framework, but it's not grounded in meditation in the same way. I think, you know, it's designed for slightly different populations as well. Of course, there's overlap. But this program is much more a meditation-based approach with skills that are part of it. And DBT, I see it as using mindfulness and acceptance as a philosophical framework, but and practices that are tied to that, but not a meditation-based program.
Yeah, that makes sense. Okay, well, this was a wonderful journey. As we speak, I already got emails asking about how we can disseminate. Is this going to be available? So really a successful webinar. Thanks so much for you guys for attending, and especially for you, Neha, for Dr. Chawla to be able to present today.
Thank you so much for having me.